Some of our listeners are confused as to which is the best natural practitioner for them. For instance, you may go to a chiropractor, but you haven't heard of an herbalist or a naturopath. You may be confused about what these terms or the terms integrative doctor or holistic doctor mean. So today, we'll discuss the different types of natural healing practices. So, what are they? Well, first, I'll talk about MDs, medical doctors. And the medical doctors that practice natural medicine are sometimes called alternative doctors, sometimes called holistic practitioners. Nowadays, they're called more and more integrative physicians. And they're called integrative physicians is because these practitioners, like my colleague Ray, combine what they like to say is the best of natural and standard Western medicine. So, for instance, Ray is a holistic physician. He uses drugs, he uses herbs, and the main part of his therapy is to use vitamins, both vitamins and other supplements, both internal as well as through IV. So, integrative physicians, I'll call them going forward, are particularly good for chronic diseases that haven't been helped with standard means. And so, holistic practitioners do a great job with gynecology, digestive disorders. Some people see them for joint and muscle disorders, depression, anxiety. Sleep is a big one. And then, due to COVID, and now we're in the post COVID age with RSV and influenza, they're also treating more and more infections. And so, what I like about integrative physicians or holistic doctors is that they make an excellent gateway to natural medicine. So, I have some very conservative relatives, and many of them live in the Midwest. I live in California, and Californians are very open to natural therapies. But in the Midwest and the South, maybe they're not so much focused on natural medicines. So I tell my relatives that I think could benefit by seeing a natural provider, well, why don't you go see a holistic physician or an integrative physician? Because at least they're a medical doctor. And my conservative relatives, particularly the older ones, go, oh yeah, yeah. Well, at least they're an MD, so they're conventionally trained. So that's really good. Now, so those are the benefits of seeing an integrative physician. What are what are the downsides? Well, the downsides are usually around money. Unfortunately, insurance companies do not pay for many natural health services. My own insurance company, if I try to bill for holistic health services, they go, that's a funny one. So, in other words, they're not interested in paying anything about alternative medicine. So, these integrative physicians, because they're more trained, they have a conventional medical license, tend to charge more money. And then the problem is that sometimes part of their services are covered by insurance, but the majority of their services are not covered by insurance. So, anyway, those are some of the pluses and minuses of seeing an integrative physician or a holistic physician or holistic doctor. The next group I'd like to talk about are osteopaths. And osteopaths have the credential DO, Doctor of Osteopath. So usually when we talk about medicine, doctors in the hospital go, well, we practice medicine. Well, no, you just practice one type of medicine, which I call either Western medicine or mainstream medicine. But osteopathy is a totally different type of medicine. To make a long story short, if you're looking for natural medicine, the osteopaths you want to see are people who do something called osteopathic manipulative therapy, that they actually have a manipulation approach to osteopathy. Other osteopaths actually practice as integrative physicians. So you may be looking on the internet and they say the Integrative Medicine Center of Hawaii or Ohio. and then it's run by an osteopath. So osteopaths are pretty much have the same training nowadays as medical doctors. They do have slightly different licensing, but the bottom line is if you're looking for osteopathic manipulative therapy, you need to go to a specialist in osteopathic manipulative therapy. The next profession I want to talk about is the naturopaths or NDs. And again, I'm going to focus on three professions that help the most for internal disease. These are seen by for gynecological conditions, digestive conditions, immune conditions, and frequent infections. So the best, in my experience, for treating those, the best natural doctors are integrative physicians, naturopaths, and herbalists. So naturopaths are licensed in many states, typically on the East Coast and West Coast, and they can perform many of the roles that orthodox doctors can offer, such as general office exams, blood testing. They may offer supplemental testing, like, for instance, supplemental testing. So one of the integrative physicians I go to actually does a lot with hormonal testing and testing various levels, nutrient levels in the body to see if you do need supplements or not. And so naturopaths do standard testing, but also use additional testing to test for things like infections, hormonal levels, GI function. One of the benefits of the ND approach or naturopathic doctor approach is they emphasize the treatment in terms of diet, lifestyle, herbs, and supplements. Some practice yet a different type of medicine called homeopathy. And at some point, if ask me if you're interested in a podcast on homeopathy. So if you are, please leave us a message on that. But I won't talk about that right now. So what are the downsides of naturopaths? Well, naturopaths aren't licensed in every state. There are people calling themselves naturopaths who aren't necessarily naturopathic doctors. So if licensing is important for you, you might want to call a doctor, a naturopath, and say, are you licensed and where are you licensed? And if you really want to know about where they're licensed, you can usually look them up on a state licensing board or association. So like MDs, medical doctors, NDs have a lack of insurance coverage. So again, it's rare for standard insurance to cover naturopath services. For instance, if it's a general office exam, in some states they may cover a small portion of that, but they're not going to cover alternative testing that standard labs don't offer. So expense is an issue, lack of insurance, and then finally, some naturopaths try to be all things to all people. So naturopaths learn about acupuncture, herbal medicine, supplementation, diagnostics, Western medicine, and some try to just do too much, be too good in too many areas, and then they fall short. So bottom line is when you're really looking, seeking out a natural therapist, it really all becomes of, do you believe this person? Is this somebody you feel like you can get along with? Is this somebody who you feel has my best interests at heart? These are some of the questions you want to ask to a prospective practitioner. And these are some of the questions you want to ask yourself when you first enter their practice. So the last group, major group I want to talk about is herbalists. At the end, we'll talk a little bit about chiropractors, and we'll talk a little bit about massage therapists. But again, herbalists for internal medicine, I think you want to look at herbalists, naturopaths, and integrative physicians. And one of the downsides of herbalists is that they're not licensed. So no state license herbalists. In certain states like California, herbalists are protected. But one of the issues is that herbalists have all sorts of different levels of training. Some herbalists, like myself, have 35 years experience. Other herbalists attend a correspondence class and say, oh, I attended a correspondence class. Now I'm a master herbalist. So again, if you're thinking about going to any of these practitioners, you want to ask, what are your credentials? What's your training? So because herbs aren't licensed, that doesn't mean that they're not as good. That just means that you may be more careful when you select an herbalist. Now, what are some of the benefits of herbalists? Well, herbalists tend to really specialize in herbal medicine. Now, the advantage of herbal medicine over drug medicine is it tends to work more gently with fewer side effects. So one of the reasons people are drawn to herbal medicine is they feel that a good herbalist can treat the condition adequately without the side effects of toxic drugs. So many people like to go to herbalists, but they have the problem of they don't know where to find a good herbalist. There are associations which can lead you into the direction of an herbalist. I'm a peer-reviewed member of the American Herbalist Guild, which is one of the best ways to locate an herbalist. But I mentioned the training can be all over the place. So you want to really ask a person, what's your training and how many people have you helped like me? If you have chronic fatigue syndrome, how many people with chronic fatigue syndrome have you helped? And tell me about it. Tell me about this. So again, whether you're selecting an herbalist, a naturopath, or an integrated physician, do I believe this person? Am I comfortable with them? Do they have my best interests at heart? Now, I just want to say a few words about chiropractors. I don't want you to feel that I'm disrespecting chiropractors. I'm a chiropractic patient sometimes myself. But we're talking really about people with infections, digestive, immune troubles. Where I see acupuncture and chiropractic entering this discussion is in pain. So if a person's main problem is chronic pain, massage therapists, acupuncturists, and chiropractors can all be very beneficial. Now, when we talk about chiropractors, remember some know a tremendous amount about nutrition. Others know nothing about nutrition. I have yet to meet very many herbalists who are also chiropractors. On the other hand, there are many, at least hundreds, and maybe even 1,000 acupuncturists in the United States who practice herbal medicine. So one of my favorite alternative medicine practitioners are acupuncturists who are trained and actually dispense herbs in their practice. And I think this is why people can get the best of both worlds. They can get the benefit of the herbs, but they can actually get the benefit of the acupuncturist diagnosis. So remember that Chinese medicine, acupuncture, and Chinese herbs are part of Chinese medicine. And the strength of Chinese medicine is not only different substances, but also a whole different diagnostic and treating modality. So I really believe that if it's practiced well, Chinese medicine has a lot of applications for helping people with chronic diseases. This concludes our podcast for today. If you'd like to see more videos like this, please comment below and let us know what topics you'd like to hear about. And be sure to like and subscribe to help us grow our channel. If you'd like to know more about us, please visit our website at getwellfoundation.org. Thanks for joining us, and we'll see you next time.